Good day! For this week's concept map, we are elaborating idiopathic thrombocytopenia purpura. By definition, idiopathic thrombocytopenia purpura, also called as immune thrombocytopenia, is an immune blood disorder that is characterized by a decreased platelet count. The name thrombocytopenia purpura reflects this, thrombocytopenia referring to a platelet deficiency and purpura or purpuric rash.
Predisposing factors, or those that are unmodifiable, are the following. First, autoimmune disease. ITP may be secondary to autoimmune disease such as lupus. Second, bone marrow diseases, which include aplastic anemia, leukemia, certain lymphomas, and myelodysplastic syndromes. Third, cancer treatment, including chemotherapy and radiotherapy. And lastly, enlarged spleen. An enlarged spleen traps platelets. Precipitating factors are the following. First, alcoholism. Second, exposure to toxic chemicals including arsenic, benzene, and pesticides. Third, human immunodeficiency virus or HIV. Fourth, antibiotics, or those that are used to treat bacterial infections. And lastly, infection, which may trigger ITP.
The immune system is stimulated to attack the body's platelets, then impaired platelet production and platelet deficiency, then delayed blood clotting. This happens when the immune system is stimulated to attack the body's platelets, which is often a result of antibody production against platelets. Because platelets are cells in the body that prevents bleeding, a lack of platelets can be easy bruising, bleeding gums, and internal bleeding. In short, the mechanism of the thrombocytopenia involves both increased platelet destruction and, in a significant proportion of cases, impaired platelet production.
Most signs are related to the decreased platelet count. First sign is easy or excessive bruising or purpura. These are the blood leaks under the skin which causes discoloration such as bruising. Second is petechiae, or those tiny red dots on the skin that are a result of very small bleed usually found on the lower legs. Third, nosebleeds. Fourth, bleeding in the mouth and or in and around the gums. Fifth, heavy menstrual periods for women. Sixth, blood in the urine, vomit, or stool. Seventh, prolonged bleeding from cuts. Eighth, fatigue. And lastly, enlarged spleen.
For the healthcare management, let us begin with the medical management. Treatment may include a number of approaches. First is splenectomy, spleen removal, as this organ makes antibodies that help fight infections. In ITP, these antibodies destroy platelets by mistake. Second is we have the platelet transfusion. Some people who have ITP with serious bleeding may need to have a platelet transfusion. And lastly, consultations. Consult a hematologist for assistance in confirming the diagnosis, or in the patient with known ITP, arranging disposition and follow-up care if appropriate. For the pharmacologic management, glucocorticoids and intravenous immunoglobulin are the mainstay of medical therapy for idiopathic thrombocytopenic purpura, also known as ITP. Glucocorticoids, as these agents are used to treat idiopathic and acquired autoimmune disorders, they have been shown to increase platelet count in ITP. And blood products, administration of intravenous immunoglobulin, may temporarily rise platelet counts in some children and adults with ITP. Consider intravenous immunoglobulin if the situation requires a rapid, temporary rise of platelet count. And lastly, thrombopoietic. These agents directly stimulate bone marrow platelet production.
Nursing management. As nurses, We manage this condition by prevent bleeding, educate the at-risk patient and caregivers about precautionary measures to prevent tissue trauma or disruption of the normal clotting mechanisms, prevent injury, thoroughly conform patient to surroundings, put call light within reach, and teach how to call for assistance, respond to call light immediately, avoid use of restraints, or obtain a physician's order if restraints are needed, and eliminate or drop all possible hazards in the room such as razors, medications, and matches. Prevent infection. Wash hands before contact with patients and between procedures with the patient. Recommend the use of soft bristled toothbrushes and stool softeners to protect mucous membranes. And, if infection occurs, teach the patient to take antibiotics as prescribed. Instruct the patient to take the full course of antibiotics even if symptoms improve or disappear.
The major nursing diagnosis for idiopathic thrombocytopenia purpura are risk for bleeding related to decreased platelet count. Second is the risk for injury related to abnormal blood profile. Third is the risk for ineffective protection related to altered kinesthetic perception. And lastly, risk for infection related to suppression of the immune system by steroids.
Now, for the diagnostic tests involved with ITP. The following are performed and ordered by the healthcare team. Complete blood count or CBC, which measures the size, number, and maturity of different blood cells in a specific volume of blood or to measure platelets. Additional blood and urine tests, which measures bleeding time and detect possible infections. Bone marrow aspiration. This test examines the platelet production and can rule out any abnormal cells the marrow may be producing that could lower platelet counts. Imaging studies. CT scan of the head is warranted if concern exists regarding intracranial hemorrhage.